Dr. Dave Sliwowicz of Teaching Practice, and you want to know about my comprehensive medical practice. A family doctor at an office called 95 Bailey Street West. I have two associates. One does teaching called Dr. Suchitra Mensinkai. Our office times are Monday to Friday, 9 to 5, but not Wednesday and Friday afternoons. In the office, we do comprehensive family practice care. Because of my age, most pediatric kids have grown up, and they're now either teenagers or grown up, so we don't have a lot of pediatrics anymore. It's sort of middle age and geriatrics. We have dedicated clinic days. First Tuesday every month is blood pressure day, second Tuesday diabetic day, third day is asthma, COPD, and fourth is cardiac. The hospital, Ajax Pickering Hospital, is the one I work at 99% of the time. I do rehab medicine there every morning during the weekday. I see about 3 or 4 patients of some interest, and I do the odd medical case, and about every 2 months I do a full weekend of inpatient hospitals patients. Community here, Ajax Pickering, is 100,000 each. We serve people in those communities, Oshawa, Ajax, and further out, and some people in Toronto. The practice profile is pretty average suburban, okay? Mostly middle class people, the odd farmer, etc., the odd blue-collar worker. The average day for a resident looks like I think I described. They'd be seeing about more than they see at the family practice unit, for sure, depending on number of residents. With one resident here, they'd be seeing about 15 to 18 patients per day, with 2 residents about 12 to 13. So that's a considerable number. It's quite a hectic pace. The number of patients we see on a busy day is about 30 to 35, which gets a little tight. How many patients on my own? I see about 4 or 5 on a session, AM or PM, okay? And with the interesting ones, I'll usually discuss the cases. And one of the highlights of my practice is the extra time taken teaching. We have time at lunch. We do lunchbox sessions in my office with the residents and discuss the interesting cases, either that I saw or that they saw, and they interact with each other. There are no after-hours clinic, okay? There's no call on the weekends unless the resident really wants to be on call. I do ask the residents on the weekend every 2 months about covering with me. There is a GO train, which is quite handy, and we can make arrangements to pick you up there. There's a GO bus.